move on to mammograms. This is another changing area in women's health care. So the Healthy People 2020 goal is to increase the proportion of women between the ages of 50 to 74 years of age who are counseled to get a mammogram. I remember a patient who had a high risk for developing breast cancer. She was overweight, actually obese, and she started her period when she was a very young lady, probably age 10, and she'd never been pregnant, never used contraception. So for many years, month in, month out, she was having normal menstrual cycles. She never had a break. I kept asking her, have you had your mammogram yet? She was counseled every single year. She'd come back and see me. Nope, I never had a mammogram. So finally, I was able to convince her. I gave her the form, and she actually went. The good news is her mammogram was normal. So when she came back to see me for the next annual exam, I congratulated her on having the mammogram, and I asked her, how was it? Her response to me was, put it this way, if there would have been an earthquake, I wasn't going anywhere. So what does this mean? When a woman has a mammogram, that breast gets clamped into a machine and you're not moving while they're taking that picture. So anyway, the U.S. Preventive Task Services has new recommendations that were modified in July of 2015. This is only in draft form at this time, but it's expected that these will be adopted by late 2015 or early 2016. It will be interesting to see how the GYN community actually embraces these recommendations. So what were these recommendations based on? Well, when we look at breast cancer death rates, we find that women between the ages of 50 and 74 have the most benefit from having a mammogram, because if they have it, we're going to find it early, we can do an intervention and reduce the risk of dying. Why not do it on women who are younger? Well, we have a high false positive rate in the younger population, and there is definitely harm associated from these false positives. Primarily, it's psychological in nature, but we put women through testing that is invasive. So we actually ask women to do self-breast exam. Personally, when I'm doing education related to performing self-breast exam, I counsel women to only do it at some point Monday through Friday, 9 to 5, when the OBGYN office is open. Whatever you do, don't do it in the evening hours, and certainly don't do it on the weekends. My rationale for this is, if a woman finds something when doing the self-exam and they can't immediately call the office to let us know and get in for a visit, by the time she finally does get in, psychologically she has herself dead and buried because she's diagnosed herself with breast cancer. Now mind you, many lumps and bumps in the breast are not cancer, but anytime you find one, you think that it is. So when we do mammograms on younger women who are at less risk of dying from cancer, and we have a false positive result on the mammogram, what ends up happening is you get the phone call. We found something. You need to come back in. Now that next visit may be as simple as doing a second mammogram with magnification views so that we can see whatever was found in a bigger view. It may mean that you just need to get an ultrasound, but it could also include having to have biopsies. All of this is very scary for a woman. And so when in the community, women start talking to one another, this chatter increases anxiety. This anxiety actually ends up decreasing the number of women who want to go in for that initial mammogram to begin with. So there is valid rationale for why these guidelines are being tweaked at this time. Now, if there's a family history If there's some reason why a woman under the age of 50 should get a mammogram, we will certainly be recommended to go ahead and do that. Now, another thing to consider is that research is very limited in regards to the benefit of having a mammogram after the age of 75. So the task force really has no recommendations on how to move forward on making recommendations for women in this age group. So the new recommendations for the women over age 40, equal to or over age 40, apply to women if they've had no signs or symptoms of breast cancer, if they've had no pre-existing breast cancer or ductal carcinoma in situ, which is what the DCIS stands for, if there's no known genetic mutations in her family history or her personal history, and if this woman has no history of having had chest radiation. So this would be things like having had a history of Hodgkin's disease, where we may have had to radiate, or some type of a lung mass that required radiation. Now, there's a subset of the population where we're really not sure where to go, or the task force isn't sure where to go, and that's the woman who has a dense breast. We know that they're at increased risk for developing breast cancer, primarily because the breasts are so dense you can't tell if there is a lump that's present. So the recommendation is we need to have more research to see what is the best means of screening this cohort. So the new standard recommendations for mammography is women between the ages of 50 to 74 need a mammogram only every 2 years. Prior to this, or actually currently before these are actually truly adopted by the GYN population at large, is to have them done annually. Women between the ages of 40 to 49 will have a mammogram based on their individual history and any risk factors that they have. And women aged 75 and older, we need more research to assess the balance between the benefit of having the mammogram versus the harm. Now, when you look at the picture on this slide, you can see how the breast tissue is compressed between these two plates, and then the X-ray beam goes through these two plates. So they do anterior, posterior views, side views, and sometimes oblique views on each breast.